Welcome to another Heat on Facebook Live, What's in Your Prevention Toolbox. Last Friday I spoke to you about condoms, lube, dental dams, and other barriers as a way of preventing STI and HIV transmission. This week we're going to talk about PEP, PEP, or post-exposure prophylaxis. Next week we'll talk about PrEP, which is pre-exposure prophylaxis, and sometimes get confused with the two. Today we're talking about PEP. The PEP treatment is a combination of antiretrovirals and protease inhibitors used to prevent HIV transmission after an exposure may have occurred. Ideally, it started within 1 to 4 hours after exposure, but must be within 72 hours of exposure. So, if you are exposed and want to use PEP, you must take this treatment within 72 hours of that exposure. There are some side effects that come with this treatment, and they include headaches, nausea, diarrhea, and fatigue. They're rare, but they do occur. PEP is currently limited in its availability in the province of Alberta, currently available to those who have experienced sexual assault or those who may have exposed themselves to a needle stick injury in their occupation. When possible exposure occurs, there is a possibility of transmission. Some of the reasons for this to occur could be a breakage of the condom or slippage of your condom, a lapse in condom use. It's possible that unsafe needle use is experienced, or an accidental exposure has occurred with a serodiscordant relationship where one person may be positive and one person may be negative. PEP is most often accessed through our emergency or first frontline care and must be approved by our by our medical officer of health in charge at the moment. So if you want to access PEP, you need to go to an emergency center. It needs to be taken within 72 hours, and it also needs to be approved by our medical officer of health on call at the time. Thanks for joining Heat on Facebook today as we talked about PEP. Join us again next week where we'll talk about PrEP or pre-exposure prophylaxis. Remember, know before you go.